It's your girl, Ariza, a licensed clinical social worker with over a decade of experience helping people just like you pass the LMSW and LCSW exam. I've coached dozens of test takers to success, and now I'm going to help you do the same thing. So whether you're a first timer or a repeat test taker, this is the place to get the tools, the strategies, and the mindset you need to level up and pass the exam. So let's go ahead and jump into it. Today we're going to be talking about psychotropic medications. Yes, psychotropic medications. And I'll be honest with you guys, before I jump into this presentation, I tell my supervisees and the learners in my course, don't focus a whole lot on medication, because to be honest, you might see 1, 2, maybe 3 or 4 questions on the exam, not a whole lot to spend your time and energy focusing on knowing all these different medications, all the different side effects and so forth. But this is going to be a quick course just to go over the essentials, so you'll have enough if one of those questions do pop up that you can go ahead and answer it and add it into the bank and go ahead and add that point. As I shared, I'm going to go into some details about the medications, and then we'll jump right into some other things, and I have some questions at the end and a surprise. If you stay to the end, I do have a free gift for you, so just stay on, watch it to the end, respond the way I tell you to, and I got the gift for you. All right, so let's talk about the categories of medication. You have the antidepressants, you have antipsychotics, you have mood stabilizers, you have stimulants, and you have the anxiolytics. So when we're looking at these various medications, of course, there is something that you have to know why one is more important or so forth than the other. So the antidepressants, you have the SSRIs, the SNRIs, the tricyclics, the Prozac, Zoloft, and Elavil. These are all the different type of medications that you're going to see that fall under antidepressants. For the antipsychotics, you have the first generation type, Haldol. Yes, I'm sure you guys are familiar with that. And then you have the atypical ones, which is Abilify. Let's move on to mood stabilizers. Lithium. Yes, lithium, if your client is taking that, you need to make sure they have their lithium levels checked, because it can cause some toxicity in their body. If they do not have those levels checked, it can cause problems with the kidneys, the livers, and other major organs in the body. So that is very important to have the clients check their lithium levels when that is something they're prescribed. And then we also have Depakote. If we go on to the anxiolytics, you also have the benzos, you have the Xanax, and you have the Buspar. These are some medications you're going to hear. And then you have the stimulants. So you have the ADHD medications, Adderall, Ritalin, all those common medications you've heard of before. These are just the various categories. So again, don't try to stress yourself, guys, in memorizing. If you want to take a nice little picture of the screen, perfect, do so, but you don't have to stress yourself over knowing it. Primary uses and conditions. Now, you need to know why people take medication. They take it if they're struggling with depression, anxiety, bipolar, schizophrenia, ADHD, PTSD. These are just to name a few. People take medication normally along with some other type of treatment. Maybe it's therapy. Maybe it's some type of social group, something they're doing to help enhance or fix a condition, but they're also taking a medication to go in conjunction with it. So let's talk about some side effects and risks. If you're taking SSRIs, sometimes the clients might experience some nausea, some sexual dysfunction. They might have increased suicide risk. If they're taking antipsychotics, you have that weight gain. So think about it. If a client is already dealing with some symptoms and they're trying to counter it or to improve by taking medications, you want to be mindful of those side effects, because if a client is struggling with, say, losing weight, and then you put them on an antipsychotic and they start gaining more weight, that's definitely not going to cause them to feel better about themselves or make the symptoms a little less likely to happen. The symptoms are going to remain there, and they're probably not going to take their medication, and they're probably not going to be consistent. So you want to make sure that we're helping the clients with those things. So then let's move on to mood stabilizers. You have the lithium, as I shared with you before. You want to make sure you're checking those toxic levels. And then stimulants. You have the risk of abuse, insomnia, all those types of things you want to make sure is not taking place. So if a client is on a stimulant and you're trying to control or fix a certain condition, but then they can't sleep and they can't eat, that's not helping. So we want to make sure we're very mindful of side effects that clients might have when they're taking these medications. Let's talk about a mechanism of action, some things we can do, some quick things. If it's SSRIs, that's used to increase the serotonin. That's what the medication does. I apologize. Not what we can do, but what the medication can do. Antipsychotics, that blocks the dopamine receptors. And then you have the stimulants, that increases the dopamine. So these are some things that you need to be mindful of and understand why clients might be prescribed certain medication because of the action that can take place when they're taking it. Medication monitoring and collaboration. Now, this is important because if you're taking a test, you might want to know what type of questions you might see. And these are questions that deal with the collaboration and the monitoring of medication. So you want to monitor the clients for side effects and compliance. You also want to collaborate with prescribers. So if a client has a nurse practitioner or a psychiatrist or a physician that's prescribing a medication, you want to monitor these symptoms and know what's going on so they can report back to these individuals, or you can report back to them when you're collaborating. And then the last one, you want to refer clients for medication evaluation when needed. Sometimes our clients are going to need to be evaluated and they're going to need to be assisted with this process. So this is something that we will do as mental health professionals. Some non-medication interventions. Sometimes medications is often paired with therapy, but sometimes it's not. Sometimes you have to identify what the client is going to need and what's going to be the best method of treatment. Secondly, you want to identify when the therapy alone is good enough or having it in conjunction with medication might be more appropriate. I've had tons of clients who struggle with depression, and I'll be honest, I've done all the interventions and pulled all kinds of tricks out of my hat. And I would think the client was getting better and improving, but their depression was so severe, it would only last for a short period of time. So these are some things that you want to be mindful of when you're working with your clients so you can have a better understanding of what they might be experiencing or what they might be dealing with, and whether the medication you're giving them is going to help and whether it's going to be beneficial. Moving on. And remember, guys, at any point in time, if the information you're getting, you're not familiar with or not clear, or I didn't elaborate enough, leave a message in the comment section. That's what I'm here for, and I'll help break it down and explain it in more depth. Cultural and ethical considerations. Understand cultural influences on medication adherence. You must make sure that that is something that you're able to do. And you also want to respect clients' autonomy when they're taking medication and the decisions that they need to make, because sometimes certain cultures don't believe in taking medication. So you as a professional have to understand the cultural beliefs of that person and why medication management just might not be appropriate. So those are some of the things you want to consider when dealing with cultural and ethical considerations. So let's talk about some commonly tested scenarios. Say you have a client and they report medication side effects. You want to report this to the prescriber. You want to let them know that this is something important and they need to let their medication management provider know this. And if the client is not reporting it, get a release, and then you would also assist and intervene by collaborating with that provider and letting them know. Another thing that might pop up on the test is a client is non-compliant with medications. So one of the options is likely going to be explore the barriers. Why is the client not compliant with the medication? What's going on in their life that is preventing them from wanting to take the medication? Maybe the medication is causing erectile dysfunction. Let's just throw that out there. So he no longer wants to take the medication. We need to be aware of that. Maybe the client likes to smoke. Maybe the client likes to drink, and they hang out every weekend and they can't do those type of activities if they are taking medication. So they decide not to take the medication so they can do the activities. I've had tons of clients with these situations. So it is very important to explore what might be the barriers with the client and preventing them from doing it. All right, and the last one, client needs a medication referral. First, we have to understand the indications, like what is the reason they need the referral for the medication management, and what are the hopes or the plans that they hope to accomplish with that. All right, let's see. Let's move on a little bit more. Let's see here. I do want to let you guys know that we're going to go through some questions right now. And the questions that we have, we're going to kind of break them down, as you can see, and then go over the answer keys and all that kind of stuff to make sure that it makes sense to you. A client is taking lithium for bipolar disorder, and they report increased thirst, frequent urination, and hand tremors. What should the social worker do first? Not what should we do next? What should we do? It's initially all the question is asking is what do we do first? So not saying that we won't do all of these things, but what is the first thing that we have to do? I always tell you guys to focus on that word right there and what is asking us specifically. So in this case, it wants to know what do we do first? 1, do we reassure the client these side effects are normal? B, do we advise the client to stop taking the medication immediately? C, do we encourage the client to discuss these symptoms with their prescribing physician? Or D, do we suggest the client decrease their water intake? What do you suggest we do? They're taking lithium for bipolar. They have an increase in frequent urination, increased thirst, and hand tremors. So these are the side effects they're experiencing. What do we tell them to do? All right, let's go. The answer is C. You would encourage the client to discuss these symptoms with their prescribing physician. You know why? Because lithium has a narrow therapeutic range, and the symptoms described here indicate that there's some type of toxicity, and we want to make sure that client seeks medical attention. Remember, I shared that in the previous slide, that if your client is taking lithium, we got to get those levels checked. So in this case, we're not the prescribing provider, so we need to make sure that they are speaking to the person who prescribed them the medication and they are aware of what's happening so they can intervene and get them the assistance they need. All right, question number 3. A client expresses reluctance to take their prescribed antipsychotic medication due to side effects like drowsiness and weight gain. How should the social worker respond? Should they A, emphasize the importance of adhering to the prescribed medication? Should they B, explore the client's concerns and collaborate with the prescribing physician to address the side effects? Should they C, tell the client to stop taking the medication and consider other alternatives? Or D, should they encourage the client to take half of the prescribed medication just to reduce some of those side effects? The correct answer is B. We want to explore the client's concerns and collaborate with the prescribing physician to address these side effects. Remember, we are not the one prescribing the medication, so we don't do any of those, and we don't tell them to take half the medication. Just take a little bit, because that'll lower the symptom. That's not our job. So we have to make sure that we're doing what we're supposed to do and staying up in our lane. So be mindful of that, guys. Social workers should acknowledge and validate a client's concerns while remaining within their scope of practice. So that is what we're going to do. And again, I appreciate you for staying to the end of this presentation. As like I shared with you guys, I have a special treat for you. So just respond in the comment section, or to make it easier so you don't have to do 2 steps, you can email me at admin@coachingtheelite.com. That's admin@coachingtheelite.com. It sounds just the way I said it, and it's spelled exactly the way I said it. So make sure that you email in the subject. You can say I want it, and then if you want to put a body in the email, just say please send it or please forward, and I will go ahead and send you this beautiful cheat sheet that you see on this next page. This is a psychotropic medications cheat sheet. It talks all about how psychotropic medications and drugs can affect the brain and the mental state and all that good stuff, and it's broken down. So you have the anti-anxiety medications, give you the common ones, antidepressants, the common ones. Pretty much, guys, this is all you need to pass the exam. We don't need you to memorize everything and know what SSRI stands for and what this is and what that is. You don't need to worry your pretty little heads about that stuff. You need to focus on the things that count and what's going to help you pass the exam. So if this cheat sheet can help you do it, and you just want to have some free time to memorize some things and study something right before you take the test, this is for you. Make sure you like, subscribe, make sure you comment, make sure you tell a friend. I really appreciate you tuning in. And if it's any content or anything that you need me to elaborate on, or you would like more of a focus, just let your girl know. That's what I'm here for you. Be blessed. I'll see you in the next one.